A trip to the doctor or emergency room often comes with the stress of a big price tag, but a new task force in Augusta is taking a closer look at just what's impacting those prices.
News Center Maine's Caroline LaCour joins us to explain the facility fees and other standards lawmakers are reviewing. Caroline.
Hey, good evening, Zach and Alex. According to a study by Consumers for Affordable Health Care, they found almost half of Maine households have medical debt, and most have carried that debt for at least 2 years. It's those numbers lawmakers are discussing in Augusta thanks to a newly appointed task force with the goal to keep an eye on industry practices.
Went to the ER for possible appendicitis. She was given an IV with antibiotics and Tylenol.
When facing a health emergency, the bill waiting when you get out of the hospital can cause more anxiety than the problem that brought you in there in the first place.
Her total bill was $9,000. About half of that was a facility fee charge.
And facility fees, an item some healthcare practices charge for maintenance, may be the culprit.
They're paying those fees based on that definition.
As a result, lawmakers and stakeholders in the healthcare field are taking a deeper look into the industry standards with a new task force meeting Friday in Augusta.
I think we all think we know what facility fees are, but we may not all be using the term in the same way.
With the term facility fees taking on a different meaning through different practices, members discussed how Maine pinpoints the definition.
Hospitals are now required to provide pricing information online about the items and services that they provide in two ways primarily.
Members will also be tasked with reviewing compliance with federal transparency laws.
Because one of the problems we have at the federal level right now is an extreme lack of enforcement. We know for a fact that 2/3 of the 6,000 hospitals in America are not compliant.
Something Marnie Carey of Power to the Patient says Maine hospitals lack, according to data from a compliance report provided by nonprofit Patients' Rights Advocate. Only 1 in 5 hospitals in the state comply with the federal price transparency rule.
I hope that there's a really clear understanding about what these fees are, that patients are informed.
With transparency being an issue nationwide, members will also look into how other states are addressing the issue.
What's going on in other states and laws that they've passed, and seeing in particular kind of the common themes of those laws.
We reached out to the Maine Hospital Association, which has a member on the task force. They sent us a statement on today's meeting saying today's discussion clearly demonstrated the confusion many have over the issue. We appreciate the comments from carriers and employer groups that they are not seeing many problems in this area. We can all certainly do a better job explaining bills. Zach and Alex.
Caroline LaCour live in the studio tonight. Thanks so much.